Gonorrhea is the second most common sexual transmitted disease. This disease targets sexually active people, and in most cases those who are infected don't even have symptoms. The symptoms for men and women have some similarities and differences, but in both cases if left untreated this can lead to infertility. If symptoms do arise, then it is best to avoid sex and go to a doctor. Unfortunately, the bacterium that causes gonorrhea, Neisseria gonorrhoeae, develops resistance for the antibiotic very quickly. Currently there are drugs that are being used to cure gonorrhea, but there are signs of resistance. To avoid getting gonorrhea, it is best to avoid all sexual contact. Also known as clap or drip, gonorrhea is one of the most contagious diseases transmitted through sexual contact. According to the Center for Disease Control and Prevention, every year in the U.S. gonorrhea infects more than 700,000 new people. What caught my interest is that according to the CDC, Center for Disease Control, only half of these cases are reported. This is because some people who are infected don't even have any signs of symptoms at all. Symptoms: some men who do have gonorrhea don't have any signs at all. For those who do have signs, these appear 2 to 5 days after they have been infected, but in some cases it can take up to 30 days for symptoms to appear. The symptoms that men usually undergo are a burning sensation while urinating, or a white, yellow or green discharge from the penis. In some cases, men who have gonorrhea get painful or swollen testicles. If this infection is not treated in men, then this could lead to epididymitis, which is a painful condition of the ducts attached to the testicles that may lead to infertility if left untreated. For women who are infected with gonorrhea, most of the time they have no symptoms. But when they do have symptoms, they are often mild, and sometimes are mistaken for a bladder or vaginal infection. Symptoms include painful or burning sensation when urinating, increased vaginal discharge, or vaginal bleeding between periods. If left untreated, women with gonorrhea can develop pelvic inflammatory disease, PID. Each year in the U.S. about 1 million women develop PID. The symptoms of PID can be mild or quite severe. Symptoms include abdominal pain and fever, internal abscesses, pus-filled pockets that are hard to cure, and chronic pelvic pain. PID can damage the fallopian tubes enough to cause infertility. In both men and women, symptoms of rectal infection include discharge, anal itching, soreness, bleeding, or painful bowel movements. Infections in the throat can cause a sore throat, but usually those who are infected in this area have no symptoms at all. For both men and women, if gonorrhea is not treated, then it can spread to the blood or even the joints, this being life-threatening. Lastly, those with gonorrhea can become infected more easily with HIV. Please subscribe to our channel and give this video a thumbs up. Share this video with your friends on Facebook and Twitter. Thanks for watching.